Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn beta blockers and potassium. So, beta blockers will cause first hyperglycemia. Because of increased glucose, there is increased insulin secretion. Because of insulin increased secretion, this will cause, obviously insulin will cause influx of potassium into the cells, so there will be hypokalemia in the blood. Thank you for watching.
Thank you and thank you for watching.